How to reduce inflammation and age well. Author's note: this guide is designed for educational purposes. While the dietary and lifestyle interventions discussed are evidence-based, they are intended to support, not replace, medical treatment. Always consult your physician before altering your health regimen. 1. The biology of inflammaging. For decades, we viewed the decline of energy and the stiffening of joints as the unavoidable taxes of time. However, modern gerontology, the study of aging, has identified a key contributing factor to the progression of age-related decline: inflammaging. 1. The two phases of inflammation. To understand how to regulate this process, we must distinguish between the two ways our body uses fire. Acute inflammation, the protective response. Imagine a kitchen towel catches fire. The smoke alarm blares, and you rush in with an extinguisher. The response is intense and immediate. Once the fire is out, the cleanup begins, and the house returns to normal. In your body, this is a healthy response to a scraped knee. It is a vital, life-saving mechanism. Chronic inflammation, the low-grade smolder. Now, imagine tiny, glowing embers trapped inside your walls. They don't set the curtains ablaze, but they stay hot 24/7. Over years, this persistent heat can char wooden beams and weaken the foundation. 1. This is chronic inflammation. It is often systemic and silent, acting as a persistent stressor on your cardiovascular system, joints, and neurological health. 2. The three triggers of the smolder. To regulate the fire, we must identify the fuel. Scientists have identified three primary biological leaks that keep the inflammatory response turned on as we age. The zombie cells, cellular senescence. As we age, some cells stop dividing but refuse to die. These linger like zombie cells, secreting a toxic cocktail of inflammatory signals, known as the SASP, that irritates surrounding healthy tissue. 1. Mitochondrial leaking. Mitochondria are the power plants of your cells. In our senior years, these plants can become leaky, spilling their own DNA into the cell's fluid. Because mitochondrial DNA structurally resembles ancient bacteria, your immune system mistakenly senses an infection and launches an inflammatory attack against its own house. 9. Gut permeability. The leaky barrier. The lining of the gut is the primary gatekeeper between the outside world and your bloodstream. Over time, this barrier can become more permeable. Tiny particles of bacteria, endotoxins, can slip into the bloodstream, triggering a systemic red alert. 10. Three. The dysregulated soldier, your immune system. As we cross the threshold of 60 and 70, the immune system undergoes a complex transition known as immunosenescence. This is not simply the immune system getting tired, it is a shift in how our internal defenses are organized and deployed. A less adaptable defense. In a young body, the immune system is highly adaptable, producing many naive T cells ready to fight new threats. As we age, we accumulate more memory and senescent immune cells, which contribute to a chronic, low-grade inflammatory state. Think of this as an army that has become dysregulated. Because it is constantly reacting to low-grade internal stressors, it may be less prepared to pivot when a new, external threat, like a seasonal virus, arrives. 1. 4. Reading the biological smoke signals. Clinicians track this hidden smolder by looking for nonspecific biomarkers that indicate the body is in an inflammatory state. Standard clinical markers. C-reactive protein, CRP, produced by the liver. CRP is a general marker of inflammation. A high-sensitivity CRP, HSCRP, test is commonly used as part of cardiovascular risk assessment. 2. ESR, sedimentation rate. This measures how quickly red blood cells sink in a tube. When inflammatory proteins are present, cells clump and sink faster. The stress connection: chronic stress keeps the hormone cortisol elevated. While cortisol is a natural anti-inflammatory, prolonged exposure may contribute to glucocorticoid resistance, allowing inflammation to persist more easily. 6. 5. Identifying the silent fire, symptoms and consequences. Because chronic inflammation is silent, it doesn't always feel like a fever or a swollen joint. Instead, it often manifests as a general sense that the body is rusting from the inside out. Common red flags of chronic inflammation: persistent fatigue, feeling exhausted even after a full night's sleep. This happens because the immune system drains metabolic energy to maintain a low-grade battle mode. 1. Brain fog, difficulty concentrating or mild memory lapses, often stemming from neuroinflammation. 11. Digestive distress, frequent bloating or gas, often a byproduct of the leaky barrier and microbiome imbalance. 10. Vague aches, stiffness in the morning or joint pain that doesn't stem from a specific injury. 1. Skin flare-ups, unexplained redness, itching, or a notable loss of skin elasticity and thinning, which can be triggered by systemic inflammatory signals. 12. Frequent infections, catching every cold that goes around because the immune system is too preoccupied with internal inflammation to fight external threats. 1. The consequences of ignoring the smolder: if left unchecked, this low-grade fire gradually damages healthy tissue. Over time, inflammaging becomes a primary driver for cardiovascular decline, inflammation scars the lining of the arteries, accelerating plaque buildup. 2. Cognitive impairment, chronic neuroinflammation is linked to an accelerated decline in memory and executive function. 11. Metabolic dysfunction, persistent inflammation can lead to insulin resistance, making it harder for the body to regulate blood sugar. 1. Reduced mobility, as inflammation targets connective tissues, joints become stiffer and recovery from activity takes longer. 3. 6. The microbiome connection. While we often think of the gut only in terms of digestion, it is actually the training ground for your immune system. Approximately 70 to 80% of your immune cells reside in the gut. The fiber inflammation axis. When you consume diverse fibers, from beans, onions, leeks, and oats, your gut bacteria produce short-chain fatty acids, SCFAs, like butyrate. These molecules are powerful fire extinguishers that travel through the blood, signaling the immune system to stay calm. 10. Probiotic peacekeepers. Fermented foods, such as plain yogurt, kefir, sauerkraut, and kimchi, introduce beneficial bacteria that compete with pro-inflammatory strains. For seniors, maintaining a diverse, internal garden is essential for lowering biological noise. Seven. The anti-inflammatory kitchen. The most effective way to modulate inflammation is through consistent, daily dietary choices. The Mediterranean diet remains the most clinically supported intervention for reducing inflammatory markers in seniors. 3. Omega-3 fatty acids, found in salmon, walnuts, and flax seeds. These fats can be converted into resolvins, which help the body transition from an active, inflammatory state back to balance. 3. Polyphenol. The vibrant colors in blueberries, kale, and cherries represent compounds that can influence gene signaling pathways related to the inflammatory response. 4. 8. Therapeutic spices, ginger, turmeric, garlic. While spices are not a replacement for medical-grade medication, they contain bioactive compounds that support the body's regulatory systems. Ginger contains gingerols, which have mild analgesic, pain-relieving effects. Turmeric, curcumin influences the NF-kappa B pathway, a major regulator of inflammation. To fix the absorption gap, pair it with black pepper, piperine, and a healthy fat, 8. Garlic produces allicin when crushed. Research suggests garlic has modest benefits for cardiovascular health and immune cell activity, 8. 9. A practical daily habit, the warm spice tea. A morning ritual is the best way to ensure consistency. The method: steep 2 to 3 slices of fresh ginger and 1/2 tsp of turmeric in warm water. Absorption support: add a small pinch of black pepper and a splash of milk, fat source, to support curcumin absorption, 8. Sugar awareness: use honey sparingly, as excess sugar can trigger an inflammatory response in those with insulin resistance. 10. The nervous system and the lymphatic cycle. Inflammation is influenced not only by what you eat but also by how your body manages stress and waste. Breathing and stress regulation. The 4-7-8 breathing technique influences the autonomic nervous system. By extending the exhale, you increase vagal activity, signaling the body to move out of fight or flight mode, 6. The lymphatic system. This acts as a drainage system for cellular waste. Unlike blood, lymph has no pump, it relies on muscle movement. Simple activities like walking or gentle chair yoga help this system circulate and clear debris, 6. 11. Critical safety and drug interactions. For seniors, the interaction between natural compounds and prescriptions is a primary safety concern. Anticoagulants, blood thinners, concentrated ginger, garlic, and turmeric have mild antiplatelet effects. If you are taking medications like warfarin, Coumadin, or Eliquis, high-dose supplements can increase your risk of bleeding, 5. Vitamin K consistency. If you are on warfarin, keep your intake of leafy greens consistent to avoid changing how your medication works, 5. 12. The Daily Longevity Framework. Ages 65 plus longevity protocol. Morning: 10 minutes of indirect sunlight to regulate circadian rhythms and support nighttime melatonin, 7. Movement: 15 minutes of gentle movement to support lymphatic circulation. Evening: practice 5 minutes of 4-7-8 breathing to regulate the stress response before sleep. Diet: aim for 3 servings of rainbow vegetables daily. Include at least one high-fiber source, oats, beans, or flax, to support the firefighting, short-chain fatty acids in the gut. Appendix I, Glossary of Terms. Allicin, the bioactive compound in garlic. Bioavailability: how much of a substance actually enters your circulation. Butyrate, a short-chain fatty acid that helps suppress inflammation. Immunosenescence, age-related changes in immune function. NF-kappa B, a protein that turns on inflammatory genes. SASP, inflammatory chemicals released by zombie cells. Glymphatic system, the specialized waste clearance system of the brain that becomes most active during deep sleep. SCFAs, short-chain fatty acids, beneficial compounds, like butyrate, produced when healthy gut bacteria ferment fiber. These help turn down systemic inflammation. Appendix II, the 4-7-8 breathing technique. Also known as the relaxing breath, this is a rhythmic breathing pattern developed by Dr. Andrew Weil. It is based on an ancient yogic practice called pranayama and is designed to act as a natural tranquilizer for the nervous system. While most of us breathe shallowly into our upper chests when stressed, this technique forces the body to take in more oxygen and, more importantly, to slow down the exhale. How to perform the technique. The beauty of this method is its simplicity. You can do it anywhere, though it is best to sit or lie down when you first start. Exhale completely through your mouth, making a whoosh sound. Inhale quietly through your nose to a mental count of 4. Hold your breath for a count of 7. Exhale completely through your mouth, making a whoosh sound to a count of 8. Repeat the cycle up to 4 times. The science, why the specific counts. The ratio of the numbers is more important than the actual time spent on each step. The goal is to create a specific physiological shift. The inhale, for allows you to take in a controlled amount of oxygen. The hold, 7. This is the most critical part. Holding the breath briefly alters carbon dioxide and oxygen levels in the blood, which can influence breathing patterns and promote a sense of calm. The long exhale, 8. By making the exhale twice as long as the inhale, you increase vagal activity. This nerve is the on switch for your parasympathetic nervous system, the rest and digest mode, which actively lowers your heart rate and blood pressure. Key benefits. Reduces anxiety. It provides an immediate distraction from racing thoughts and physically forces the body to calm down. Aids sleep. Many people use this technique specifically to fall asleep faster, as it mimics the breathing patterns of a body in deep relaxation. Manages anger. It provides a pause button during moments of high emotional reactivity. Modulates the stress response by calming the nervous system and reducing fight or flight signaling associated with chronic stress. This practice supports the body's natural regulatory systems that influence inflammation. 6. A pro tip for beginners. If you find it hard to hold your breath for 7 seconds or exhale for 8, you can speed up the counting. As long as you maintain the 4 to 7 to 8 ratio, the physiological benefits remain the same. Dr. Weil recommends practicing this at least twice a day, but never doing more than 4 breath cycles at a time until you are well practiced. References.